Namaskar and welcome to Apollo 24/7's Health Hour. We want you to be happy and healthy, and that's why we are here on this Sunday with Health Hour. Today we're going to talk about blood pressure. Hypertension के बारे में हम लोग बात करने वाले हैं. Please join us in this live session with all the questions we want to ask. We have a wonderful doctor expert joining us. Dr Srimathy Venkatesh will join us very shortly and answering all the questions. She is a qualified medicine specialist, and she'll be coming up with answers. So also on this show, you will be able to win prizes. We're going to have a health quiz as well, and we're going to give vouchers. Let me introduce our expert for today. Today, we have Dr. Srimathy Venkatesh, consultant physician at Apollo Hospitals, Grimms Road, Chennai, and she's experienced with more than 18 years. She's a professional member of Indian Society of Critical Care Medicine as well. Dr. Srimathy Venkatesh can be consulted for hypertension, diabetes, thyroid disorders, infectious diseases, cardiology, and pulmonology as well. There, Dr. Srimathy Venkatesh is joining us. Good morning, ma'am, and welcome to the show.
Good morning, Ms. Jansi. Good morning, everyone. Happy to be here to share this time with you and present some kind of insight into high blood pressure or hypertension. Looking forward to this session. Over to you, Jansi.
Great, ma'am. So let me start with this. I'm not sure if this is a myth or you must be able to guide me. When people say that, बहुत गुस्सा आता है तो BP बढ़ा है. So is this anyway linked with each other? Are our emotions and high blood pressure linked in any way?
Okay. So as a direct answer to your question, yes, they are. Emotions are linked to blood pressure in the sense that emotions can increase the heart rate. It can go through a lot of hormonal changes in the body, which results in high blood pressure. But that emotions per se are not the cause for high blood pressure or hypertension, as we call. Blood pressure is diagnosed in the clinic with a high blood pressure reading. Blood pressure is the pressure that is exerted by the flowing blood in the arteries in the body. And when it exceeds a certain limit, it is called hypertension or high blood pressure. So both are not synonymous. High tension in the mind and hypertension are not synonymous, but people tend to use it that way. What we are going to talk about is hypertension per se, which is high blood pressure readings in the office of a doctor or at home or at places of stress, which can cause havoc in the body by ways of secondary organ damage. So blood pressure is not a one-time diagnosis. As we find a high BP reading in the clinic, suppose normally it is incidental. Most people are not aware of blood pressure symptoms. You go to a doctor for a fever and the doctor checks your blood pressure and you find that it is high. So one reading of blood pressure is not enough to diagnose or label a person as a hypertensive. We go through a series of check-ins, observe and label them as a blood pressure patient before actually starting on pharmacological therapy. But a single reading of high blood pressure also warrants lifestyle modifications and monitoring. So the diagnosis of hypertension, I think we
take
will
that
go
as an alert. We need to take that as an alarm or an alert.
Yeah.
So understanding that one incident cannot be taken as to diagnose you as a hypertensive person. But what is a clinical definition? Is there a definition that this person can be classified as hypertensive?
Yeah. So any blood pressure reading of greater than or equal to 140/90 in the office setting or at house after a period of physical and mental rest, if this is consistent, then we label the patient as a person as a hypertensive. Okay, so normal optimal blood pressure is 120/80. There are stages of blood pressure readings. So after normal blood pressure is ideally less than 130/80. If it crosses that limit, then we label them as a pre-hypertensive, and then proper hypertension if it crosses 140/90.
Okay, and let me also talk about people like me who are classically under the reading parameters. So always by 80s, 90s. So what are these low blood pressure categories called as?
Okay, so actually speaking, in a individual, if he is or she are not as symptomatic with the giddiness or so, the lower the blood pressure, the better for organ preservation. So it doesn't really mean anything unless it is associated with other features, like, for example, a fever causing low blood pressure or a chest pain and breathlessness causing low blood pressure. Then we are aware that it is because of something in the body which is the reason for the low blood pressure. But low blood pressure per
Okay.
se is not a dangerous thing.
Right. So great, ma'am. So quickly, as you were saying that symptoms ho sakte hain. Now you mentioned giddiness as a symptom. High blood pressure maybe ये giddiness एक symptom दिखाई दे सकता है ना? What are the symptoms to classify high blood pressure?
Okay, as I said, more than 90% of the people are not aware of blood pressure fluctuations. The classical symptoms of blood pressure, like giddiness or a persistent headache, early morning headaches, feeling of fatigue, breathlessness, exertional symptoms, or bleeding from the nose or bleeding from through the urinary tract, etc., happen in very few patients, probably about 10%. That is when the hypertension comes into light. Many a times, hypertension is diagnosed when a person comes with a heart attack or with a stroke. So these
Okay.
are people who have already gone through a stage of hypertension with secondary organ damage. So that is why it is important to check the blood pressure in the initial stages. We start screening from nowadays, even from childhood, we should say, because hypertension is happening in children as well in some cases because of the obesity, because of the wrong eating habits, etc. So it is important that screening is done as at least yearly screening as we cross the year of as we cross 20 years of age.
All right. So now, blood pressure के बारे में जब सुनते हैं, it's become so common. We hear it. I'm not sure if I am being more sensitive or aware to these cases now, or have the incidences increased? Why am I hearing so much about rise in the hypertensive cases?
Okay. So the increase in the incidence can be because of two things. One is we are aware, a little more aware than what we were earlier. So we are able to screen people. So the incidence is increasing. The second, our lifestyle has changed drastically over the years. That is also the reason for increase in the incidence of blood pressure. There are modifiable and non-modifiable risk factors for blood pressure. Non-modifiable factors being, a strong family history of blood pressure, um, age over the 65 years of age, and other coexisting diseases like a heart disease or kidney diseases. All these are non-modifiable risk factors, but there are modifiable risk factors that we will see subsequently. One is obesity, wrong diet, lack of physical activity, altered sleep wake cycle. All of us sleep at 12 and wake up at 9, which has become a routine. Habits like smoking, alcohol, all these to
Yes.
name a few. These are modifiable risk factors, which probably we should address each of them. In the long run, it will be very beneficial.
Of course, ma'am. And then let me also, I wanted to ask you a lot of common questions, doubts, and myths. So, one question that I wanted to ask is that men are more prone to hypertension. कहीं ये मैंने पढ़ा था. How far is this truth? Are men the only people who will get hypertension? Are they more prone to it?
Studies have indicated that up to the age of 60, sixth decade, men are more prone to hypertension than ladies. This may be because of the higher BMI, their habits, the stress of life, and hormones. Ladies are to some extent protected by their female hormones till the age of menopause. After menopause, the incidence of blood pressure is almost similar between both the sexes. And again, as ladies, as they start taking part in professional careers, and there is a gender equality now. So probably that is the reason why nowadays the recent studies have indicated that almost similar incidences of blood pressure in ladies and men. But in general, overall, men are more prone to blood pressure till the age of 60. After that, kind of equalizes.
Okay, so it's not that only men get it and women do not get it. There's no
No.
classification of gender there. Yeah, so everyone can get it and any age can be affected. So it's better to be alert and keep aware of how you're living, and lifestyle makes a lot of importance. So to sum up, Dr. Srimathy Venkatesh can speak in Tamil and she also speaks partly in Bengali. So ma'am, can I ask, and I speak Telugu, so I'll quickly do one recap in Telugu as well. Can you, अब तक जो हमने बोला है कि symptoms क्या होते हैं, then a little brief about management of lifestyle, if you can say it in Tamil for us, please.
ஓகே. ஸோ ரத்த அழுத்தம்ங்கிறது எல்லாருக்கும் பொதுவானது தான். இப்போ இந்த காலகட்டத்தில் நம்ம பிளட் ப்ரெஷர் மானிட்டர் பண்ணி பண்ணி எப்போதும் அதை நார்மலாக வைக்கிறதுல ரொம்ப அவசியம் இருக்குது. நாட் ஓன்லி மருந்து, சாப்பாடு விஷயம், எக்ஸசைசஸ், தூக்கம் எல்லாமே இம்பார்ட்டன்ட் ஃபார் பிளட் ப்ரெஷர் கண்ட்ரோல். உங்களோட மருத்துவரை எவ்ரி 3 months அணுகிறது ரொம்ப அவசியம். ஏன்னா எப்போ பிளட் ப்ரெஷர் வரும்னு யாராலையும் ப்ரெடிக்ட் பண்ண முடியாது. தோ ஏஜ் ஆக பிளட் ப்ரெஷர் இன்சிடென்சஸ் ஜாஸ்தி ஆகலாம். அதர் ஃபேக்டர்ஸ் இருந்துச்சுன்னா, அதாவது சுகர் இருந்ததுனாலோ இல்லை கிட்னி ப்ராப்ளம்ஸ் எல்லாம் இருந்ததுனாலோ நிச்சயமாக உங்கள் டாக்டர் கிட்ட அணுகி உங்கள் பிளட் ப்ரெஷர் செக் பண்ணுறது அவசியமாகும். ஸோ லைஃப் ஸ்டைல் மாடிஃபிகேஷன், அதாவது எக்ஸசைஸ் பண்ணுறது, சரியான சமயத்தில் சாப்பிட்றது, சரியான சமயத்தில் தூங்குறது, கரெக்டாக 10 to 12 glasses ஆஃப் தண்ணி குடிக்கிறது, அண்ட் டீஸ்ட்ரெஸ், ஏதாவது ஒரு ஹாபி எடுத்துட்டு கொஞ்சம் டைம் டு ஸ்பெண்ட், உங்களுக்காண்டி கொஞ்சம் நேரம் ஒதுக்கி அந்த சமயத்தில் உங்களோட ஸ்ட்ரெஸ் எல்லாத்தையும் கம்மி பண்ணுறது ரொம்ப இம்பார்ட்டன்ட்.
Yes. So Dr. Srimathy Venkatesh also speaks Bengali, Tamil, Hindi and English, and I speak Telugu. For all the audience who have just joined us, we have been talking in English and Hindi. Yes, we will continue in English and Hindi, but whenever necessary, we will reach out to audience who require in the languages that we will be able to speak. Okay, so yes, Mr. Abe, we understand your concern, but we'll keep the show predominantly in English for you. All right. So, Doctor, as we were talking about a lot of other complications which can coexist with hypertension or hypertension can create. For example, diabetes के साथ partnership जो high blood pressure का है, ये इन दोनों का रिश्ता नाता काफी सदियों से है. How dangerous are these combinations?
Right. So these are non-communicable diseases, as we call. So diabetes, blood pressure, which can be the forerunners of a cardiovascular event or a stroke event. These normally coexist. So when we diagnose hypertension, we also look for diabetes, we look for high cholesterol, we look for thyroid disorders. All these non-communicable diseases can be called as sisters, as you say. So once one comes in, the others can usher in also. So we'll have to be vigilant. So as we see a patient with high BP readings, we evaluate everything. So including sugar, kidneys, urine, cholesterol profile, and the thyroid, along with the heart evaluation with the ECG, echo, TMT. So it is very important that they can coexist. And as we know that these are all risk factors for cardiovascular diseases. So almost 75% of cardiovascular deaths are as a result of hypertension or diabetes. So along with the family history and cholesterol levels, but these are the front runners. So to prevent long-term complications, for example, hypertension and diabetes can affect any organ from head to toe, but more so with the cardiac, with the brain, with the eyes and the kidneys. These are the 4 things which we really need to look into, because these are the organs affected by hypertension more commonly as a secondary organ damage because of 2 things. One, blood pressure injures the arteries inside. So what happens is, because of the damage, there is platelet aggregation, there is cholesterol deposition. So this is something called atherogenesis, which is accelerated by blood pressure. That is one thing. This could be the reason for the various blocks that happen, which causes a heart attack or a stroke. And second is due to peripheral resistance, a lot of stagnant blood flow. Again, that can also cause clotting to happen. So these are called small platelet clots, which block arteries, which result in a heart attack or a brain stroke. So we need to be vigilant.
So ये आप समझिए कि ये सिस्टर्स की तरह, बहनों की तरह है, जो हाइपरटेंशन और डायबिटीज और कुछ और आपके साथ हो रहा है, तो ये कोलेस्ट्रॉल, ये बहनों की तरह साथ साथ चलते रहते हैं एंड ऑर्गन डैमेज कर सकते हैं. स्पेशली हार्ट स्ट्रोक दे सकता है, ब्रेन स्ट्रोक हो सकता है, क्लॉट्स हो सकते हैं, एंड ऑल्सो मेजरली अदर ऑर्गन्स के साथ आंखें भी इनका असर पड़ सकता है, आंखों के पर भी ये असर हो सकता है. Ma'am, I had one of my neighbor, due to high blood pressure, he lost almost incredible amount of vision he lost. Is this possible? The eye specialists, once they consulted, They said it's due to hypertension. Is that possible, no?
Yes, it is possible. It is the same mechanism of atherogenesis. So, because of persistently high blood pressure, particularly in the intraretinal arteries, there can be blocks. There is something called central retinal artery occlusion and central retinal venous occlusion. This can result in vision loss, and also because of the persistent increased pressure, there is a lot of fluid leak into the retina. There is a lot of new vessel formations we call as hard and soft exudates which form. So the retina itself can be damaged and predisposed to retinal detachment. So overall, it can cause damage to the eye in select individuals.
Yes, yes, yes. A lot of people are asking me, they've now started to ask questions. So I will take the questions very shortly, but wherever you are watching it on Facebook or any other social media platform, if you want your question to be answered, my dear audience, please type only in the YouTube chat box so that I can see the questions live here and ask these questions to pose these questions to Dr. Srimathy. Ma'am, in general, a lot of them are asking, what is the value, especially Govindarajan ji पूछ रहे standard reading के लिए, what is the value? ऊपर का क्या बोलते हैं, नीचे का क्या बोलते हैं, and then अगर एक single, is there a single measure that we can conclude that the BP is high or low?
Okay. So we blood pressure is normally written as a systolic and a diastolic blood pressure. So there's a reading up and then there's a reading down. The top one is the systolic blood pressure, which is the blood pressure in the arteries when the heart is beating. The lower one is the diastolic blood pressure, which is the blood pressure when the heart relaxes in between beats. Both are important for diagnosis of blood pressure and also for future complications. The normal average blood pressure is 120/80. Optimal blood pressure we can call as 130/80. So at all times, irrespective of other diseases, it is better to maintain blood pressure at 130/80. And the blood pressure measurement is also important. When you walk up the stairs and then you check your blood pressure, it will be high. So 5 minutes of physical and mental rest. So as you walk into the doctor's chamber or when you're going to monitor at home also, rest for 5 minutes, apply the blood pressure cuff, rest a bit, and then check the blood pressure. That will be a correct BP reading. So any exertion, for example, coughing, laughing, everything can push your blood pressure up. This is a body's mechanism to improve the blood supply to the brain and the rest of the organs. Without that, we will not get perfused fully, and that is also dangerous. So the body's defense mechanism is to increase the blood pressure on exertion. So when we look at blood pressure, hypertension per se, we call it hypertension only when physical and mental rest, if the readings are consistently over 140/90. That is the if it is equal to 140 or by 90 or greater than that, we diagnose hypertension. So the grading of hypertension is like that. So we grade it as grade 1, grade 2, grade 3. Up to 180, we can push for only lifestyle modification along with monitoring. But if even the first reading is above 180 or 100, we have to start treating pharmacologically, not only lifestyle intervention, but pharmacological intervention is needed. Grade 3 hypertension, that is, any blood pressure greater than 180 by 100, needs pharmacological intervention along with lifestyle management. Till then, we can monitor and take a trial period for about 3 months and then keep monitoring. If the blood pressure is consistently high, above 140/90, even then you start on pharmacological intervention as well.
Well, so this is very very important information and tip that you shared, ma'am. That rest करके जो BP का परीक्षा करना है, जब करते हैं, that's very important. How you rest. నేను తెలుగులో కూడా ఒక్కసారి మన ఆడియన్స్ కి చెప్తానండి. రక్త పరీక్ష చేసుకునే బ్లడ్ ప్రెషర్ పరీక్ష చేసుకునేటప్పుడు మీరు 5 నిమిషాలు నడిచొచ్చి మెట్లెక్కొచ్చి డాక్టర్ గారి చేంబర్లో కూర్చుని బీపీ పరీక్ష చేయించుకోవడం డెఫినెట్లీ ఎక్కువే ఉంటుంది. అంచేత మెంటలీ అండ్ ఫిజికలీ, అంటే మీరు కనుక శారీరకంగా మానసికంగా 5 నిమిషాలు రెస్ట్ ఇచ్చిన తర్వాత బీపీ క్యాలిక్యులేట్ చేసుకోమని చెప్పారు డాక్టర్ శ్రీమతి. మ్యామ్, అనదర్ క్వశ్చన్ దట్ మిస్టర్ శేషారావు హ్యాస్ ఆస్క్డ్, ఇఫ్ ఐఎమ్ టేకింగ్ బీపీ మెడికేషన్, what time should I take the medication? Is it important to maintain the timing of taking the medication?
Yes. So if you're used to taking it in the mornings, take it at around 9 o'clock. So whether you eat or not, irrespective of your meals, you start at 9 o'clock. Some blood pressure medications work better when you take in the night. So it will be given by your doctor. The doctor will prescribe when to take the medications, either in the morning or in the night. But stick to time. So if it is 9 in the morning, 9 in the morning, and 9 in the evening is 9 in the evening. So do not mess up. So do not skip doses. Do not vary the time. Don't take it in the afternoon if you're supposed to do it in the morning. So keep to time, which is very important.
Yeah. So, ma'am, I keep seeing my parents, for example. They're very very particular about having a timely medication. But then, what happens by mistake? कोई नया अभी शुरू किया है कि ये time भूल गए हैं. 1 or 2 hours later, they remember that they've not taken the tablet. Can they immediately take the tablet, the missed dose, or do they leave it for the day?
If it is not too late, but if they are on multiple medications, it is better to skip that dose. But if not, if they are only on a single medication and they've skipped the dose, they can take it within 4 hours after skipping the dose. It is okay. If they ask and when they remember, they can take it.
Great. So, Chaitali Shah has shared an input here. Chaitali says, yes, just 15 days before I lost 70% of my left vision due to BP. जैसे आपने बोला है, she's continued. This is so shocking to see that we think that blood pressure is something that cannot do damage to us. ये internally क्या damage करता है हमें पता भी नहीं है. What are the other organs or other? Can this cause? Is this life threatening, ma'am? Can it cause emergencies as well?
Yeah. So blood pressure itself is called silent killer because many a times it is incidental, as I told you. It can land people in certain emergencies, which are called hypertensive emergencies. We call them as malignant hypertension or accelerated hypertension. Persistently high blood pressure over 180 by 120. They present with mental system changes, for example, a confusion or a dizziness or unconsciousness. They can present with acute pulmonary edema, meaning breathlessness because of the heart being affected. They can present with vision loss. They can present with acute kidney injury, acute renal shutdown, which can result in accumulation of toxins in the body. So these we are always alert to hypertensive emergencies. We cannot be slow in when we take the treat hypertensive emergencies according to the clinical condition of the patient. If in some situations it is very necessary to reduce the blood pressure within an hour's time, but many we do a gradual reduction of blood pressure so that there is no other damage to the rest of the body. So it is a medical emergency which requires admission into the hospital and treatment with the intravenous medications to reduce the blood pressure. When we talk about organ damage, we talked about all these already. So the eye, the kidney, heart, and the
Brain.
brain. So apart from this, the small problems which can come up later. For example, a little cognitive impairment, little bit of dementia, and little bit of vision loss. They can be persistent and present late also. So we have to keep in mind all these as well. So that is why it is better to keep the blood pressure under strict control from the very beginning.
Yes, I am waiting to see if people want to ask about medications. A lot of people are asking about medications here. But then prevention के बारे में कोई पूछ नहीं रहे. Let me ask that question. Can this be prevented altogether?
Absolutely. So we did talk about modifiable risk factors. Okay, so we start with diet. Okay, so there is a diet which is diet approach to stop hypertension. There is a DASH diet which is available. You can look up on the net. So which involves a little high potassium and a low sodium diet. This basically involves consumption of nuts, legumes, whole grains, lean meat, low-fat dairy products. Okay, basically a lot of fruits and vegetables, and low-fat non-vegetarian food. So apart from diet, regular physical activity is absolutely mandatory. Earlier days we were walking to wherever we went to school walking, but nowadays it is all two-wheeler or four-wheeler. So that is one aspect of life which we need to take care. Many of us do not find the time to exercise because we are working 12 to 14 hours in a day. Where do you find the time to walk is a question constantly asked by my patients. But I tell them health is wealth, so there's no point in running around and not taking at least half an hour in a day to yourself which is you can do anything, whatever you feel like doing, like dancing or gardening or aerobics or whatever you feel like doing. Some kind of physical activity is mandatory. Third is watch your weight. So obesity is a uh, menace nowadays, we should say, particularly in children because of the wrong food habits. The fast food, as we call it, the pizzas and sandwiches and the processed food, all of these are high in fat and also empty calories. So this causes a lot of obesity overall, all over people are obese, as we call it.
Yeah.
Uh,
Ma'am, as you talked about obesity here, I would want to take Karthik's question, who's just 23 and he weighs 99 kilos. He's trying to lose weight. 155 by 90 is his BP, ma'am. 23-year-old, 99 kilos. 155 by 90 is the blood pressure. I am now taking the Telma 40 he is taking, ma'am. Will my BP ever get to normal? Yeah, while he's trying to do a lot of exercises and maybe his weight. I hope Karthik, you are on your weight loss, whatever weight management के ऊपर भी होगा. But what is your advice for Karthik, ma'am?
Okay. So many people like Karthik are obese and with a high borderline high blood pressure nowadays. So we have this primary essential hypertension and secondary hypertension, which are known. Okay, so hypertension is something where there is no cause that is found for the blood pressure and it needs treatment lifelong. Secondary hypertension is something which is secondary to something. For example, in his case, probably obesity. Does Karthik, do you snore? Is he here live
Karthik,
or?
quickly, no, ma'am. Karthik, quickly answer. Do you also snore? While Karthik types this out, let me see. You can continue, ma'am. He'll take.
Yeah, so there are certain secondary causes of hypertension. For example, iatrogenic. During COVID times, we gave steroids to so many people, so they developed hypertension. So that is one of the causes for secondary hypertension. Likewise, there are certain tumors which can increase blood pressure. For example, adrenal gland tumors and steroid-producing tumors can increase the blood pressure. Chronic kidney
Yeah,
disease itself can cause blood pressure. So all and something
ma'am.
like a
Karthik
renal.
had. Yeah, sorry, ma'am. Karthik has replied, I had my ASD closure in February 22 and snore.
Okay, okay. So there is this condition called obstructive sleep apnea, which is being recognized world over. The incidence is increasing in the recent times. This is a vicious cycle of snoring and weight gain. So because of the snoring, because of the narrow airway, oxygen to the body during sleep is compromised. So there is a lot of daytime sleepiness. There is a lot of fatigue, which prevents people to be physically active. So this is a condition called obstructive sleep apnea, which we investigate with a study called sleep study to find out whether it is significant or not. That could be one of the reasons for blood pressure in the young with weight gain. Okay. So the other
Yeah.
things are obesity itself is one risk factor for blood pressure. Other things which we look at is thyroid disorder. Okay. And
Mm.
in the younger age group, there is this condition called renal artery stenosis, which is a secondary, which is a cause for hypertension in many young individuals. These are rare, not very common. So these tumors and renal artery stenosis and all are rare. But in a young individual, as they come to our office with high BP readings, we screen them for all these secondary causes. If the secondary cause is treated, then blood pressure comes under control, or you can say that it can be cured. So in
Yeah.
Karthik's case, weight loss will go a long way in controlling blood pressure. Eventually, it's possible for him to go off medications, but at the moment, he needs to be on medicines.
Yes, ma'am. So while we did talk about Karthik's weight loss measures and BP controlling, I did see somebody who's already playing badminton, works out a lot, but still their BP is on the high. They do take regular medications. Their BP is still high. How can we help them?
Okay, so as we said, there are these non-modifiable risk factors. For example, a strong family history, and hidden diabetes and things like that. There is a entity called resistant hypertension. Even after optimizing dosages of more than three medications, up to three medications for blood pressure, the blood pressure doesn't come under control. So in these patients, we will have to monitor the blood pressure more frequently than the others. We'll have to screen for secondary organ damage more frequently than the others and titrate the medications accordingly and introduce new medicines as per their needs. This resistant hypertension treatment is tailor made, done in consult with the local physician or the cardiologist, and done carefully because it is very important.
Yes. So yes, while we understand that medication के साथ मेरा बीपी कम नहीं हो रहा है, a lot of people have asked this question, ma'am. I've been taking medication, फिर भी मेरा pressure मुझे काफी टाइम से high blood pressure देखने को मिल रहा है around 140, 110, and then many more, ma'am. So what does this indicate? They are on
So
medication and their blood pressure doesn't come down.
Okay. So we'll have to look for other causes. As I told you, this renal artery stenosis or hidden kidney related issues or hidden heart related issues have to be looked into. Second thing is compliance with medications. So if they don't take their medications on time, and if they don't take the right dosage of medicine. See, for example, according to the body weight, if a person has to take about 5 milligrams, they take only half. There is this resistance to taking medicines. Can I take half a tablet is a regular question asked. So anyway, you're going to take a tablet. Why not one full instead of half? That mentality should change. So the compliance with medication is very important. And other lifestyle changes have to be made. We'll have to look at stress as the cause. We'll have to look at inadequate sleep as the cause. So each aspect of life has to be looked into, and then the treatment should be finalized.
Yeah, Manohar Reddy garu, మీరు అడిగిన question కూడా ఇదే. Manohar Reddy is asking, sometimes my blood pressure rises even after taking 40 mg of Telma. Suggest treatment course. So they must be, and one more thing I would want you to add and reiterate here, that especially with blood pressure medication, people do self medication a lot, especially with monitoring their dosage. How good is this and how worse this can get to? Any cases that you have seen, ma'am?
It is dangerous. There are people who overdose themselves and come up with low blood pressure, what is called as orthostatic hypotension, meaning as they get up, the blood pressure drops even further and they get giddiness. So, blood pressure medicines have to be titrated according to patients. It cannot be one prescription. Many people do this. My father is taking Stamlo, so I took Stamlo 2.5 and my headache disappeared. Is it correct? But it is not correct. So you cannot use other people's medication for blood pressure treatment. You will have to visit your doctor, evaluate, and then take the correct dosage of medicines. Do not overdo the medicines. So as you said, emotional problems. So I feel stressed out. I feel that my blood pressure is rising. So I'll take one extra tablet of blood pressure. It doesn't work that way.
Yeah. Ma'am, other medications and then hypertension. This is something that I would want to take up, ma'am. Ankita Mahapatra is asking, Ankita is 15-year-old female who's taking antidepressants, but
Okay.
due to these antidepressants, her BP is always fluctuating. It always wanders around 80-40, and pulse rate is also getting low. What step should I take? Will it get dangerous?
So if the pulse rate is low like this, it is possible that it is a side effect of the medicines that she is on. So many of the medicines can cause rhythm abnormalities in the heart. For example, fast heart rate or a low heart rate. So this needs to be addressed. A low pulse rate of 40 is not allowed. So it has to be evaluated further and her medicines have to be revised. Yet another problem with antidepressants is it can affect the thyroid. So it can cause hypothyroid status. So that may be one of the reasons for a low pulse rate also. So that needs to be looked into also. So 80 by
Yes.
40 and 40 heart rate is not okay. So she has to consult a doctor.
Yes, ma'am. And here's one common question that people have been asking: salt. We look at salt as culprit. Are there good salts, rock salt or Himalayan salt or pink salt or black salt or the colorful salts? How good are these? And then Are there any other home remedies like no Saku is asking 2.5 liters to 3 liters of warm water, will this help reduce hypertension? These are some general questions, ma'am. Myths and facts, please.
Okay, salt is salt, but as I talked about the diet, so a low high potassium and a low sodium salt has been found to improve blood pressure in some people. So probably the pink one salt, which is probably less salty than the normal regular white salt that we use. But
But what's the
whatever,
point when you adjust it to the taste, ma'am?
yeah.
So it is.
Yeah, so there is a limit. Even if it is a low sodium salt, there is a limit. So you cannot overdo on that. That is one thing. And water, 10 to 12 glasses of water in a day is okay, but that per se may not be the only treatment for her blood pressure. So that has to be combined with all the other aspects of blood pressure management as well. So basically, avoiding caffeine like cokes and so all these aerated drinks can bring down the blood pressure because they all various. Many people have about 5 cups of coffee in a day and say that the blood pressure is up, which is bound to happen. So high caffeine is bound to push the blood pressure up. So avoid this and do a lot of vegetables and fruits and a handful of nuts, probably almonds and walnuts, which are found to be beneficial. And eat whole grains as a principle because all these refined substances do have, apart from the salt intake, because most of the stuff which we prepare from the refined flour has a lot of salt intake. So basically, you should watch your diet if you have it and say avoid pickles, papads, and all as much as possible. Once in a while, it is okay. Adding extra salt on the table is a no-no, and that's about it. And low-fat
I
dairy
hope my
products.
mom is listening to this. I hope my mom is listening to this in Hyderabad somewhere. Pickles and peppers. Yes, ma'am.
That is
So,
a part of the diet on a regular basis, I suppose. So, but then we should.
yes, yes, ma'am. So Raya Siddiqui ji, आपका question यहाँ पर answer हो गया है. Can certain foods be helpful to lower high blood pressure? Yes, ma'am has answered what diet you have to take. So let me talk about the side effects of taking BP medications on a long term. A lot of people are worried that I'm taking this from so many years. Been taking, and will this affect my kidneys? Are there any side effects? No, Saku ka question hai.
Okay. So there is no pharmacological therapy without a side effect. Okay. The good thing is that we are aware of the side effects that can happen, and we time to time monitor. So what might happen? For example, the common telmisartan that we use can push up the sodium, can push up the potassium a little bit. Okay. So can cause sometimes a cough. So there are side effects with all medications. The normal, commonly used amlodipine can cause swelling in the feet and can cause chronic headaches. So we are aware of whatever the side effects happen, but long-term use is mandatory because we have got only about 8 classes of medications that are available. We cannot keep changing them. So as we arrive at a prescription for a patient which suits the patient, which controls the blood pressure, and which is preventing secondary organ damage, we stick to it. So, some on a long term basis, most of them do not have long term side effects per se. And anyway, we are monitoring for them. And blood pressure is a lifelong process. So, most people will have to take medications lifelong. And only certain classes of drugs are available as per availability. We have to continue the same drug for many years. There is no other choice, but it is okay because we will be monitoring them yearly with our tests and we are aware of the complications which may happen and we will revise the prescription if needed. So, this will be the case.
Yes,
So, regular follow
yes,
up with the
ma'am.
doctor is mandatory. So
Yeah,
many of the
yeah.
patients say, I follow your prescription about 5 years old. They don't come to me within this area, within this number of years. And then
Period.
if it's side effect, then it is possible.
Yes, ma'am. So while we understand that you have to be regularly taking your hypertension medications, blood pressure के जो भी prescribed medication है, doctor के सलाह से regularly लेते रहिएगा. But you mentioned that monitoring is very important. So can we quickly throw what are the tests that one can take other than physically checking the blood pressure? What can what else as a blood test or any other test that you would prescribe?
So we normally prescribe yearly checking of the kidneys, the heart, okay, and for diabetics, 3 months monitoring is mandatory of blood sugar status, and the thyroid. These are the four things which normally monitor yearly, and every 3 months office checkup of blood pressure is mandatory. Home BP monitoring is allowed nowadays, but even then, 3 monthly visit to the doctor is mandatory. So when we were talking about the resistant hypertension patient, right? So this is somewhat frequent nowadays. So there is this thing called ambulatory blood pressure monitoring, which we use, which for diagnosis of blood pressure and for treatment of blood pressure. This involves measuring the blood pressure for 24 hours. Every half an hour, it will keep measuring the blood pressure while the person can go ahead with his normal activities of eating, sleeping, working out, everything. So with that, with the average blood pressure, we are able to come to a conclusion as to how good the control is, or whether any stepping up is really needed or any stepping down is needed. So this is one tool which we use if needed in a patient with resistant hypertension. Apart from that,
Yes.
yearly cardiac workup about ECG, echo, and treadmill, if possible, it is good.
Great. So in continuation with the same thing, Johnson जी पूछ रहे हैं, डॉक्टर जी प्लीज ऑल्सो रिप्लाई मैनुअल बीपी मशीन से चेक करना बेटर है या डिजिटल मशीन से? प्रॉपर टाइमिंग्स डॉक्टर ऑलरेडी बता दिए हैं बीपी चेकिंग के लिए. ऑल्सो मिस्टर जॉनसन डिड आस्क इफ यू आर प्रिस्क्राइब्ड 3 different kinds of medications of blood pressure, is it okay to take all of them together?
Okay. So blood pressure can be monitored with a digital manometer with the correct cuff, with the correct posture, with the correct way of application, and it is okay to check blood pressure with a digital apparatus. Nowadays, a mercury apparatus will not be available anymore because of the mercury toxicity. So we are left with only it is going to become a worldwide standard, I suppose, in a few years to come, that we use only digital apparatus for monitoring blood pressure. So at the moment, we have in our clinics the normal sphygmomanometers, which may not be available in the near future. So after some time, some years, so it is okay to monitor blood pressure with a digital apparatus. Second question. So combination therapy for blood pressure is known for a long time. We have been using it. So if your doctor has prescribed 3 medicines to be taken at the same time, it is okay to take the 3 medications at the same time. So if by prescription, if it is at the same time, it is okay to
If it no,
take.
I think he is prescribed. Can he take all three together?
No, so we normally, according to the heart rate, according to the individual, we give some medications in the morning, some in the night. For example, a beta blocker is given in the night, whereas a telmisartan is given in the morning, like that. So whatever prescription is given by the doctor has to be followed. So it is.
Great.
So he cannot do it on his own. So if he is prescribed 3 medicines together, it is okay to take.
Yes. Two questions here, three questions in fact I'll club together and give you, ma'am, as I'm running short of time and I have a lot of questions pending as well. Ravi Kumar Chikkaramaya, ma'am, my blood pressure is 140/98, my weight is 96. Can you please suggest to control without medication? One question. Two, can I wean off? Somebody else is asking, can I wean off from my blood pressure medication because it's been very long? And three, can I quit allopathic medicine? Are there any other natural medications from other branches of medicines?
Okay. Okay, so I will not be aware of natural medicines apart from allopathy because I'm an allopathy doctor. So I would suggest, as tell my patients, because I am aware of the side effects of medicine that I'm going to prescribe, whereas I may not know anything about Ayurvedic medicine, so I'm not able to
Very
confirm,
true. You're right on your part. Yes.
yeah. So the 140/98 is borderline blood pressure, so grade one. So it can be managed with lifestyle modification. We talked about this. So if there are any habits, kick them off. No smoking, no alcohol.
Yeah. You
Diet,
just gave the entire. रवि
yeah.
जी
So
थोड़ा पीछे
diet,
जाके पूरा एपिसोड देख
exercise.
लीजिए, that will be nice.
Okay, all right.
Yeah.
And
So, ma'am,
weaning
to
off,
wean off.
Yeah, so weaning usually doesn't happen with blood pressure because blood pressure is a dynamic process. So what we look at is a resting blood pressure, but then it should not overshoot when a person exerts himself. For example, if he goes on a treadmill, blood pressure is bound to increase, but then it shouldn't overshoot, isn't it? So normally we don't wean off blood pressure medicines. If the blood pressure is under control with a certain prescription of medicine, we continue it lifelong. And it doesn't matter if it is for a long period of time.
Yes, ma'am. And I just saw somebody with 170 plus BP, and I'm trying to place out. That's okay. And quickly, electrolytes. Regarding maintaining correct electrolytes and balance, mostly when while taking diuretics, uh, do BP medications affect these electrolyte imbalances, ma'am?
Yeah, so there are a class of medications called diuretics, which are used for control of blood pressure. For example, chlorthalidone and hydrochlorothiazide. These medications are used usually in combination with other medications. These potentially can lower the sodium in many patients. So, particularly in the elderly. So, when we are starting them on diuretic, we'll have to be very cautious and monitor them closely for low sodium. So, these in case a low sodium happens with the diuretic, we don't know. We cannot really predict who will develop low sodium with a certain class of diuretic. So we'll have to monitor. Once we start a person on chlorthalidone or hydrochlorothiazide, we monitor the electrolytes probably once in 3 months initially. Once they are set to the medications, they can continue. But in the
Yeah.
event of suppose a vomiting happens, a diarrhea happens, they are not able to hydrate themselves well, they are not able to eat that time, electrolytes can fall, particularly with continuing use of these diuretics for control of blood pressure.
वैल्यूबल इन्फॉर्मेशन मैम, थैंक यू सो मच। विजय वेल जी, आपका क्वेश्चन आंसर किया गया है। आयुर्वेदिक के बारे में मैम आंसर नहीं कर पाएंगे, सो थैंक यू देयर। राजू शाह, 31 year old, I've been recently diagnosed with high BP of 189. That's the case that I was mentioning, ma'am. I didn't find the name. 189 by 100, 31-year-old male, sedentary lifestyle, weight has increased earlier, say 5-10 kilo increase हो गया है. What can I do? And this is such an alarming number, ma'am.
Yeah, so as I told you, anything over 180, 100 needs pharmacological intervention. There is no way that he can escape medicines now. But as I told you, he needs to evaluate for secondary hypertension. So, in a young individual, though primary hypertension is becoming common in age, even some people less than 20, we still consider 31 as young. So he has to look at obstructive sleep apnea. He has to look at thyroid disorders. He has to look at renal parameters. There are some congenital
Yeah.
heart conditions which can push up the blood pressure. For example, a coarctation of aorta. So there are a battery of tests which we normally do to rule out any secondary cause for hypertension and take it forward accordingly. But then he needs pharmacological intervention now, so he should consult a doctor.
Yes, ma'am. Gestational blood pressure. I found this question. किसी को मोहम्मद सलीम जी के भाभी 25-year-old थे when she got baby during a pregnancy. 5 साल हो चुके हैं ये इंसिडेंट को, पर अभी भी she is continuing on medication. Is there any way of coming out of this as possible? Is this possible to come out of the situation? Like
Okay,
gestational
so
diabetes,
yeah, so
can gestation.
hypertension in pregnancy is known to happen, something called eclampsia, which may happen in the last trimester of pregnancy. But many a times it is essential hypertension, probably which goes unnoticed even before the pregnancy. And then, if she is on medication for the last 5 years, it is most likely only essential hypertension, and that pregnancy as causation is gone now. So she will fall into the essential hypertension category, and then she has to continue medications. As I said, again, rule out any secondary cause. For example, oral contraceptive pills can push up the blood pressure, and other things like overweight again. All this we'll have to address. And a strong family
Yes,
should have hypertension if it is there, and I suppose it is essential hypertension which needs to be considered. Yeah.
right. So, ma'am, cholesterol and hypertension, can we establish the connection here? Uh, there are a lot of people who have given their hypertension along with the cholesterol figures as well. What is the connection between these two, and how are they correlated?
Okay, so there is no direct causative mechanism. Cholesterol doesn't cause hypertension, and hypertension doesn't cause cholesterol. So overall, it is the body's tendency, genetic tendency for both. So both to some extent have a genetic predisposition. For example, high cholesterol runs in families and hypertension runs in families. So both first is the genetic predisposition, and again lifestyle. So all those things which we looked at, like obesity, lack of physical activity, and habits, all these can push up both. So they normally, as I said, they kind of coexist, though they are not causative. Each is not causative of other, but they coexist. So one lifestyle change can help control both. But according to the age and the diabetic status of the individual, cholesterol has to be treated in most instances if the blood pressure is also high.
Okay, ma'am. So next continuation to combination of high blood pressure is gastric issues. Bibu Ranjan Chakravarti says 30-year-old gastric issues induce high blood pressure, 160 by 100 sometimes. What to do? Is there a connection between gastric issues and high blood pressure, ma'am?
Any pain in the body can push up the blood pressure, but then not gastric issue per se. So there must be something hidden which they're missing for the blood pressure. So again, if at physical and mental rest without any gastric issue, if he's maintaining a blood pressure, it is okay. Probably then he should address only his gastric issues. Then the blood pressure will come under control. But if not, then
Huh.
they'll have to look at any hidden reason.
Okay, ma'am. Uh, Suddenly BP shoot होता है. Sean David, 65-year-old, clinically 28 by B, A by D. Okay, I am not understanding what your question is, but BP is mostly under control. At times, suddenly it shoots up. What to do with the for the immediate reduction?
Okay, so just rest mentally and physically and recheck again. So if it is still continuously high, look for other causes. So for example, pain in the body or some painkillers that he has taken or some other medications that he has taken. So we'll have to look into that. If it doesn't come to normal range at the end of rechecking, then probably he should visit his doctor to find out why this spike is happening, why this high spike in blood pressure is happening.
Yes, ma'am. Again, coming back to medication, stop करना है इनको. Chiranjeev Bishnoi, my brother recently started BP medicines. However, after a few days, his BP is getting low. Should he stop having medicine? One question. Dr. Satish Kumar Panigrahi, can one stop BP medication if it's settled to normal range?
Okay, so in the first instance where the blood pressure is getting low, two reasons can be there. Probably he's not on the correct dosage of medicine if the blood pressure diagnosis is confirmed, or his diagnosis, as I said, probably this was preemptly started even before a proper diagnosis of blood pressure. So we'll have to look at what it is and then see whether he can discontinue. Usually uh, under the supervision of a doctor only you can do this. So if a doctor has said that to continue, if the low blood pressure is low, then definitely, particularly when he stands up, if there is giddiness and the blood pressure goes low, then it means that the blood pressure medicine is not for him. So he has to probably revise and stop, and he can should consult the doctor again. But without consulting the
Okay.
doctor, nothing should be done by himself.
No,
Okay,
ma'am.
so if he stands and if he feels giddy, if the standing blood pressure is lower by more than 20 points from the resting sitting blood pressure, then definitely his blood pressure medicines can be stopped and rechecked.
Yes. గ్రేట్ మ్యామ్. సో తెలుగులో మళ్ళీ ఒకసారి చెప్తున్నాను. బ్లడ్ ప్రెషర్ కనుక బాగా ఎక్కువ ఉండి మందు వేసుకున్న తర్వాత అది విపరీతంగా తగ్గిపోతున్నట్టయితే డోసేజ్ కరెక్ట్ గా లేకపోయి ఉండొచ్చు. లేకపోతే నుంచున్న తర్వాత బ్లడ్ ప్రెషర్ కి, కూర్చున్నప్పుడు బ్లడ్ ప్రెషర్ కి తేడా ఉన్నట్టయితే కరెక్షన్స్ అవసరం పడుతుంది. మీరు బ్లడ్ ప్రెషర్ మాత్రలు డాక్టర్ గారితో రెగ్యులర్ గా పరీక్షలో ఉండి వారి సలహా ప్రకారం మాత్రమే వాటిని మార్చుకోవాల్సి ఉంటుంది. మనం స్వయంగా ఇలాంటి మార్పులు చేయడానికి వీల్లేదు. Dr. Srimathy, would you want to add this bit into
Yeah,
Tamil
so
where
if it is debilitating, for example, he is not able to stand and he is feeling giddy, then he should stop the medicine and consult the doctor immediately.
Yeah. Would you
Otherwise,
want to add this in Tamil?
if he is not having any symptoms, but only at monitoring at home is showing a blood pressure of low blood pressure, but otherwise, if he is comfortable, then he should continue and consult the doctor. Many a times, the digital apparatus that they use at home may not be calibrated well, so it may show erroneously low readings. Okay,
Correct. Which is
so
also important.
this
My father had changed a number of digital devices and then battery low की वजह से भी हो सकता है. It is a very important fact. Let's not get that
so
wrong there. Yeah.
yes, yes.
Yeah.
So
One last question for today, ma'am. Here's Mr. Selvam, 33-year-old, kidney transplant patient, and BP ranges between 125 to 135 systolic, 90 and 100 diastolic. I have reduced salt intake and I'm walking, but my BP does not reduce. Please guide.
what are the medications it is on for blood pressure
Okay,
person?
I don't have time and I don't have
Okay.
enough.
So
But
again,
Mr. Selvam,
it depends on the medication. Particularly in a kidney transplantation, it is mandatory to keep the blood pressure under control to prevent further damage to the transplanted kidney itself. So if the blood
right.
pressure is ranging between this and he is monitoring at home, he should consult his doctor immediately for revision of prescription.
Great. Selvam ji, एक काम कीजिए, Dr. Srimathy Venkatesh can be consulted on Apollo 24/7 as well, along with your transplant therapist, whoever is taking care of you. Well, ma'am, thank you. It was such an insightful session. I must say, you've empowered us with information today. And I would want you to condense all of this and give me top tips of how to manage blood pressure.
Okay. Uh, the first one is be aware that there is something called hypertension. So routine
Top
check
tips.
mandatory, routine health checkup mandatory. Second thing, make lifestyle changes. We talked about diet, we talked about physical activity, we talked about sleep, we talked about de-stressing. So all this is kick off the habits of smoking and alcohol. All this is absolutely mandatory. Third thing is regular follow up with your doctor if you're a hypertensive, at least every 3 months, and yearly checkup for all your end organs, for example, your heart, your eyes, and your kidneys, mandatory. The fourth, do not stop medications on your own without consulting your doctor. Most of the time, blood pressure medicines have to be continued lifelong. 99.99% of the time,
Yes.
blood pressure medicines have to be continued lifelong. So do not stop medications on your own. So home BP monitoring and ambulatory blood pressure monitoring can be used to monitor the control of blood pressure and for diagnosis of blood pressure. Adequate water intake, adequate sleep will go a long way in controlling blood pressure as well. Catching early and treating blood pressure is very important to prevent cardiovascular morbidity and mortality. So be aware, uh, keep fit, stay fit.
Thank you. Thank you so much, Dr. Srimathy. It was a wonderful session.
Thank you
Today,
so
I've
much.
understood that nothing and no corner should be left untouched, especially when you know that there are risks of hypertension if you don't eat well, exercise well, and sleep well. So these three basic things I'm taking back. A little more empowered I'll leave today. Thank you so much, ma'am.
Thank you so much for the opportunity.
Yes, this was a great session. Thank you all for participating and asking your questions. I always believe that your question is not just your independent question, it's an answer for many more people who are watching this show. Thank you for asking all your questions, audience. And here's a chance for you guys to answer my question and then win prizes from Apollo 24/7. You can answer the question on the YouTube chat box. Once the winner's name will be announced, you'll have to write back to us to claim your gifts, marketing at apollo247.com with all your contact details. Winners will be selected at the sole discretion of Apollo 24/7 team. Gift vouchers will be shared with you. चलिए आज के 3 questions ये रहे on the screen. Question number 1. Please state in true or false. Men are more prone to hypertension. True or false? Question number 2. Fill in the blanks. Hypertension is when your dash is higher than average. आंसर ऊपर ही लिखा हुआ है, सही देख लेंगे तो पता भी चल जाएगा, क्लू भी दिया है मैंने. Fill in the blanks. Hypertension is when your dash is higher than average. Question number 3. Apollo 24/7's Dash membership is a premium healthcare program. It starts with C and there's a letter L also in the blanks. You can see the blanks and take the clue from the blanks and fill in the blank there. Apollo 24/7's Dash membership is a premium healthcare program. What is it called? मैंने clue भी दिया है आज. So please type your questions on YouTube chat box. I'm waiting. Okay. Okay. A lot of people are answering false. Pressure circle. Okay. Let's see who the winners are for this week. In the meanwhile, I want to give you the the discount coupons that you can use on Apollo 24/7's app. Download the app first. You can use these coupons there. डायरेक्ट डॉक्टर कंसल्टेशंस आप अपोलो से पा सकते हैं at flat 150 rupees off on the first online doctor consultation. The code you have to use for this is first VC. The code first VC use कीजिए and you get 150 rupees off on doctor consultations on the first online doctor consultation. Download the app right now and use your coupon code. The next coupon that we give away today is first 3. You order medicines direct from Apollo, flat 25% off on online medicine orders, and it's valid on the first 3 online orders from Apollo 24/7. So go ahead, download Apollo 24/7 and use the coupon first 3 while ordering medicines as well. And exclusively Health our viewers ke liye, while you were here answering, taking insights and also asking your questions. We understand that this is a very important time, and here we are giving you an exclusive coupon for Health our viewers. Use the code HH247 to get 199 off on online consultation with Apollo doctors and up to 20% off on medicine orders. And आज के winners है, congratulations, Harminder Kaur, Sonia Sharma, Vibhu Ranjan Chakraborty. Congratulations. Please write back to us at marketing@apollo247.com to claim your gift vouchers. Thank you all. And next week we have this interesting session. We are going to talk about joint pains. How do we manage joint pains? So join us and ask all your questions. Do not miss this session. And if you don't want to miss, please subscribe and also bell notification icon hai jo notifications on karta hai. Go ahead and also subscribe to Apollo 24/7 YouTube channel. See you next week. Namaskar.